Hello, and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which is responsible for the Wisconsin State Health Insurance Assistance Program, otherwise known as SHIP. SHIP is a federal program, which means each state has a SHIP program. The state of Wisconsin has SHIP counselors available in every county to help with your Medicare issues. In Wisconsin, you can find a SHIP counselor in your area by going to your local Aging and Disability Resource Center, or ADRC, or you can call the SHIP helpline. The phone number is here listed below. It is 1-800-242-1060. I work as a SHIP counselor for the state of Wisconsin. So if you are deaf, hard of hearing, or deafblind and live in the state of Wisconsin, you can contact me. My VP number is listed below, and it is 262-347-3045. Otherwise, you can email me as well. My email is jenniferm.kane@dhs.wisconsin.gov and is listed below for you as well. If you're from another state, you can still reach out for a SHIP counselor in your area as well to help you with any of your Medicare issues.
This presentation will discuss Medicare and is divided into 6 parts. The next part is Part 5, and we'll discuss Medicare Part D, SeniorCare, and annual open enrollment period. Welcome to Part 5 of this educational series. In Part 5, you will learn about prescription drug coverage, including Medicare Part D and Wisconsin SeniorCare, as well as Medicare's annual open enrollment period. Remember, there are 2 ways to receive Medicare Part D prescription drug coverage. The first way is through a standalone Part D plan or through a Medicare Advantage plan that includes drug coverage. And don't forget that Wisconsin has a prescription drug assistance program called SeniorCare, and we will discuss this program more soon. Medicare Part D is Medicare prescription drug coverage. If you choose Original Medicare and you want prescription drug coverage, you must choose and join a Medicare prescription drug plan. You usually pay a monthly premium. These plans are run by private companies that contract with Medicare. Again, Part D coverage is provided through Medicare prescription drug plans, or PDPs, and through Medicare Advantage plans with prescription drug coverage. You can compare plans and enroll in a plan on Plan Finder. And this is located at www.medicare.gov. There are a few different times that you can enroll in a Part D plan. The first time is to enroll during your initial enrollment period. This period starts 3 months before you start Medicare and includes the month you start Medicare, as well as 3 months after starting Medicare. The second time is during the annual open enrollment period. That is from October 15th through December 7th of every year for coverage starting January 1st of the following year. The third way is for people who are already enrolled in a Medicare Advantage plan. There is a Medicare Advantage plan open enrollment period, which runs from January 1st through March 31st. Again, this is only for people who are already enrolled in a Medicare Advantage plan. The fourth way is through a special enrollment period. In certain circumstances, such as moving out of your planned service area, you may be eligible for a special enrollment period, which would allow you to change your Medicare prescription drug coverage outside of the other enrollment periods. That means you can change your plan at any time, only if you have a special enrollment period.
The costs for Medicare Part D plans include premiums, deductibles, and copays or coinsurance. These costs vary by plan and change every year. Part D plans can have a deductible. However, some plans may not have a deductible at all or may have a lower deductible. Copays and coinsurance vary per drug, per plan, and per pharmacy. This means your cost for prescription drug coverage will depend on the plan you choose, which prescription drugs you take, whether you go to a pharmacy in your plan's network, and whether you get extra help paying for your drug costs. You are able to find and compare plans, which we'll discuss how to do in a few minutes. Please keep in mind that people who have higher incomes may pay an additional amount on top of their monthly premiums. This amount is based on their level of income reported in their tax filing. Only about 5% of people with Medicare pay this additional amount. Remember, costs change every year. To see current costs under Part D and to compare plans, visit www.medicare.gov.
Note that you want to avoid the Part D late enrollment penalty. It doesn't matter if you're taking prescription drugs or not. If you decide not to enroll in a Part D plan during your initial enrollment period and you do not have other credible drug coverage, you may be charged a late enrollment penalty. The penalty is 1% of the monthly premium for every month you delayed enrollment. And it will be added to your monthly premium if and when you enroll in a Part D plan. And it will continue as long as you have your Part D plan. Creditable coverage is other prescription drug coverage that is expected to pay, on average, at least the same as Medicare's standard Part D coverage. For example, veterans drug coverage or Wisconsin SeniorCare are considered credible coverage. Some types of employer coverage are also considered credible coverage, but it is important that you investigate, ask, and clarify to be sure that you have credible coverage.
This graphic sums up the Medicare Part D coverage phases. The amounts within these phases change each year. If your plan has a deductible, you pay for the full cost of your medications until you reach your deductible. After you've met the deductible, your initial coverage period will begin. During this phase, you will pay either a copay or a coinsurance amount for your medications. This will be no more than 25% of the cost of the drug or an actuarially equivalent tier structure. Some plans may have low-cost generic drugs with very low copays during this initial coverage period. If your total drug costs reach the set limit for that year, you reach the coverage gap. The total drug costs include both what you pay and what your plan pays for your drugs. The total drug cost limit changes every year. If your total out-of-pocket drug costs reach the set limit for that year, you will begin the catastrophic coverage period. During this time, you will pay $0 for all drugs until the end of the year. The total out-of-pocket drug cost limit changes every year. Co-pays for covered insulin are capped for a 1-month supply. Again, costs change every year. To see current costs under Part D, you can visit www.medicare.gov/basics/Medicare-costs. Or you can compare plans at www.medicare.gov.
Medicare Part D plans cover a few things. The first being prescription medications. Understand that not all medications are covered by all plans. Part D plans cover medications that are included in their plan's formulary, which means a list of covered drugs. Part D plans also cover insulin and needles and syringes. The medications must be for medically prescribed use to be covered. The law excludes certain medications from coverage under Part D. Now, you may be wondering what items are not covered by Medicare Part D. And I can list a few. So medications that are not on the plan's formulary would not be covered by Part D. So make sure you check with your prescription drug plan and ask to see their formulary. If your drug is not on that list, no, it will not be covered. It will not cover non-prescription or over-the-counter drugs. It will not cover drugs that are not approved by the Federal Drug Administration or the FDA. It will not cover vitamins and minerals. It will not cover cough medicine. It will not cover medications for erectile dysfunction. And it will not cover drugs for cosmetic purposes. This includes weight loss or weight gain or medication to address hair loss. Also keep in mind that off-label use of prescription medications is not covered by Part D. An example of this is if a doctor prescribes a medication for a condition, but the FDA does not approve the use of that medication for that condition, then the drug will not be covered, even if this drug is included in the plan's formulary for use with other conditions. Another option for prescription drug coverage is Wisconsin's Prescription Drug Assistance Program, which is called SeniorCare. This program is available to Wisconsin residents who are 65 or older and who are US citizens or have a qualifying immigrant status. There is no monthly premium for this program. There's only a $30 annual application fee. SeniorCare is considered credible prescription drug coverage and will help you to avoid the Part D penalty. There is no asset limit. Your annual income will determine your SeniorCare level of coverage and how much you pay for your prescriptions. So people with lower incomes at a level 1 have no deductible for their prescriptions. And they pay copays of $5 for generic drugs and $15 for name brand drugs. Level 2A and level 2B do have a deductible. Level 3 has a deductible and a spend down. If you want more information or you want to apply for this program, contact SeniorCare online, or you can call them at the phone number, which is 1-800-657-2038. The annual open enrollment period for Part D and Medicare Advantage plans is October 15th through December 7th each year. Part D and Medicare Advantage plans are a one-year contract that are effective from January 1st through December 31st. Part D plans and Medicare Advantage plans can change their details, like their plan formularies, the pharmacies that are in their network, their monthly premiums, and other costs. That's why the plan itself is required to send you a notice of change each year by the end of September. You can use the annual open enrollment period to review your plan and compare it with other available plans in your area to make sure that you will have appropriate coverage in the new year. If you sign up for a new plan between October 15th and December 7th, your new coverage will begin on January 1st.
The best way to find and compare plans is to use the plan comparison tool known as the Plan Finder. This tool is on the Medicare website, which is www.medicare.gov. For assistance with Medicare questions or with plan comparisons, you can call Medicare directly at 1-800-633-4227. You can call the Wisconsin SHIP or Medigap helpline at 1-800-242-1060, or you can call your local SHIP counselors. You can find your local SHIP counselor by contacting your county's Aging and Disability Resource Center, or ADRC, or by calling the SHIP phone number.
If you're comfortable using a computer, you can go to medicare.gov and click on Find Health and Drug Plans. This will bring you to Medicare's plan comparison tool known as the Plan Finder. The Plan Finder will explain what to do and how to find and compare plans. If you put in your specific medication information, your pharmacy preference, and your zip code, you'll be able to get an estimate of your annual costs with each of the plans available in your area. You can enroll in a plan online through Medicare Plan Finder or by calling Medicare. You can also contact the plan directly. You can find the plan's contact information on the Medicare Plan Finder. Again, if you don't have access to a computer, or if you would like assistance with finding and comparing plans, please be sure to call one of the resources provided on the previous slide. This concludes part 5 of the Welcome to Medicare program. I hope this information is helpful. In part 6, we will close the series with information about help for people with limited income, tips for protecting yourself and preventing fraud, and we will review the resources that are available for you. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a local free public service for people with Medicare. If you have questions about Medicare, contact the Wisconsin SHIP today. If you are not from Wisconsin, you can contact a SHIP counselor from your state. You don't have to do this alone.